everyone to another wonderful episode here, Just Podiatry. There's one condition that we see a lot called metatarsalgia. Okay. Metatarsalgia, in very, very simple terms, is a type of, we'll say, bursitis. Okay? Extremely painful. Could be caused by many different reasons. Right? In this particular case, it's been we have a young patient who several months ago, it's been how many months now?
Came for the procedure March 14th.
So March, a week before March 20th, that's when the market crashed because of the COVID. And the patient originally presented with a tremendous amount, when we talk about the symptoms of this, right? Pain. What type of pain? Numbness. Burning, dull, achy, pain. What else?
Inability to just move around. Yeah.
And we see this condition in patients with, we'll say, several, a certain type of foot structure. Loss of fat, right? Loss of fat. Biomechanical abnormalities. I could go on and on and on. In this patient's particular case, the metatarsals, if this is the skin right here, the metatarsal was dropped, right? And there was no space between the metatarsal and the skin, right? Where's the fat? Where's the accommodation? So what we basically did was a minimally invasive procedure to do this, to raise the metatarsal head, right? And now create a space, right? Where there's more now fat. So we went from this to this. A lot of women that wear stilettos, for example, that have been like this for 20, 30 years in that position, because they've placed so much pressure for such a long time, they've basically melted that fat away. And that creates a lot of pain. Again, metatarsalgia. And I'm sorry I'm talking a little bit slow. It's because the mask is what's inhibiting me from taking my next breath. But regardless, let's take a look. The patient presented, come through the bottom here, Caesar, please. The first thing is first. The patient had a tremendous callus here. Okay? Tremendous. It was an IPK, an intractable porokeratosis, extremely painful. And it was a result of what we call dislocation syndrome, where the metatarsal, the toe, dislocates off the metatarsal phalangeal joint. So just to give everyone an idea, this is what happened. Boom. This is the metatarsal, this is the toe. Again, I repeat, boom. So the head was, this is the skin, pressure, bone equals painful callus. So we realigned, we did what we needed to do via minimally invasive. We cut the bone, and the bone, believe it or not, has a mind of its own. It knew that the minute that we performed that cut, right? The minute that we made that cut, that bone, the metatarsal, right? This part of the bone went boing. And it knew exactly where it wanted to be. It was sort of asking us to do this. And it wasn't only the second, it was also the third metatarsal. So now, it's been April, May, June, July, 4 months. The patient, I asked her today, how are you feeling?
Great.
100%
Yes.
verbatim. When we go like this, number one, the callus never lies. Where's the callus? Gone.
Gone.
I go like this, I don't feel what I used to feel, which is all bone, no fat, skin and bone. Now, I feel a Tempur-Pedic mattress, right? And again, everything was done. You can actually see a little bit of a hypertrophic scar here, right here. And then we moved the toe a little bit this way, right? But everything came out absolutely wonderful. A lot of people have never heard of this term, metatarsalgia. This is extremely painful. Patients who, and it's not only the young crowd, this happens, again, as you get younger or older, you lose fat. Fat is there for a reason in our feet. Integral role. This is a great, this is a really great case. We continue to do these procedures for patients that present with this condition. Google it. Metatarsalgia. Metatarsal, right? From the metatarsals. And anything that ends with algia, inflammation. Like itis, tendinitis, bursitis. People, there are solutions. No screws, no pins, no plates. There's nothing in there. This is a one-stitch procedure. Dr. Wagner, I don't understand how you're able to do this through one little stitch. I know. Everyone's wondering the same thing. The proof is in this pudding. The foot pudding. As always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jawspodiatry, Facebook, and last but not least, our YouTube channel. Minimally invasive anesthetic foot and ankle surgery does exist, people. It does. Have a wonderful day.